Osteoarthritis. It is degenerative disease of the joints due to the old age, and so it is called as disease of wear and tears. Usual time of onset is after 40 years. Both the gender can suffer this ailment, and this disease consists of three phases: mild, moderate, and severe. In severe stage, there is permanent damage to the joints and produces disability to the patient. However, nowadays proper treatment can provide success to eradicate the severe and final stage of the disease. In this disease, there is damage to the soft cartilages of the joints, especially the small joints of the hands and feet. Later, the bigger joints also suffer due to loss of cartilages. Bone over bone movement produces friction and damage to the ending of the bones, along with the synovial ligament, membrane, then the soft tissues, ligaments supporting the joint, and produces the degeneration of the synovial fluid, which produces swelling and the pain to the joints and the inability to movement of the relative joint. The symptoms is there is pain, swelling, and stiffness in the early morning, which lasts for less than 1 hour, as compared to the rheumatoid arthritis. That period is more than 1 hour. But in this, there is almost 30 minutes duration, and which is relieved and produces comfort to the patient when he is at rest. That is, the exercise or the movements or the exertion potentiate the pain of the osteoarthritis. There is crepitus and the crackles during the movement of the joints, especially of the big joints like knee and shoulder joint. There is production of the nodes in the distal and proximal interphalangeal joints of the hands, which are very diagnostic feature of this disease. Crepitus production and the nodes formation, they are the clinical findings of this disease. Now we talk about the diagnosis. Clinical history is sufficient, physical examination is sufficient. Moreover, we also provide or perform X-ray of the relative or the affected joints. Then MRI for detailed study of the soft tissue and the ligament damage, cartilage, and the inside the synovial cavity. Furthermore, we can also produce sonography of the joints. The diseased joints can be studied by ultrasound. We can visualize the interior of the joint, the pathology, and the degeneration process of the disease. Moreover, the latest diagnostic procedure is arthroscopy. In this, arthroscope is inserted into the joint, which is fitted with the light and camera. We can directly visualize the interior of the diseased joint. We can study the loss of the ligaments, loss of cartilages, then damage to the synovial cavity, fluid degeneration, and other pathology. And we can also, along with this examination, extract or drain the fluid in the joint collected, and we sent that sample to the laboratory for cytological studies. Moreover, if there is superadded infection, then there are also accumulation of the WBC in the fluid of the joint. The diagnostic procedures, they are very efficient to diagnose the disease at the earlier stages and to provide treatment to the patient at the best time of, that is the as earlier as possible, so that we can avoid the final stage, that is the severe or the critical stage of the disease, which is not remediable, which cannot be treated and lead to the permanent lock up and the disability of the joint.